Diabetes is a big problem and affects approximately 5% of all Americans. With good control of blood sugar levels and treatment of associated cardiovascular risk factors, the complications of diabetes are largely preventable. Non-insulin dependent diabetes affects 15 million Americans, and half of the individuals do not know they have diabetes. Diabetes is increased twofold in African Americans, fourfold in Latinos, and tenfold in Native Americans. Diabetes is the leading cause of kidney failure in the United States and the leading cause of blindness and a leading cause of leg amputation. The real shame is that with good control of blood sugar and appropriate treatment of the early diabetic kidney and eye problems, blindness and kidney failure are usually preventable. The likelihood of having a heart attack or stroke is increased 2 to 4-fold in diabetics. In fact, over 3/4 of diabetics will ultimately die from cholesterol blockages in the large arteries feeding the heart, brain, legs, and other internal organs. Lowering blood sugar, treating high cholesterol levels, and high blood pressure markedly reduce the risk of having a heart attack or stroke. Diabetes is the leading cause of leg amputation in the United States. Proper education about foot care combined with treatment of diabetes, high blood pressure, and high cholesterol levels has been shown to decrease the risk of amputation by 10-fold. If we work together, control your diabetes and the risk factors associated with diabetes, the complications of diabetes can be prevented or delayed significantly. Diabetes is a disorder of the body's regulation of the common sugar glucose as an efficient energy source. The basic unit of life is called a cell. A group of cells is called tissue, and a group of specialized tissues are called organs. The brain, heart, stomach, and kidneys are common body organs. It is the different organs that make up our body. In order for the cells of the body to function properly, glucose is used as an efficient energy source. This is much like a car needing gasoline as an energy source rather than coal or wood. In order for glucose to enter the cells of the body to be used as an energy source, the hormone insulin is needed. Insulin can be thought of as the key that unlocks the cell door, allowing the glucose particle to enter and be used. The problem, which we call diabetes, arises when the body does not regulate glucose properly. In general, normal blood sugar levels in the morning before eating are always less than 110. When a person's fasting blood sugar is greater than 140 points on 2 occasions, the person has diabetes. Others with fasting blood sugars between 120 and 140 are considered to be diabetics if their blood sugars run higher than normal after eating food. There are 2 types of diabetes. One type occurs when there is a total absence of insulin. When this type of diabetes develops, blood sugar levels become extremely high, such as 500 to 900. People with this type of diabetes cannot get sugar from the blood into the cells of the body. As a result, the cells of the body are effectively starved even though the person is eating a lot of food. When the blood sugar levels rise over 200 points, the blood sugar is filtered by the kidneys, causing the person to make large amounts of urine. To keep from dying of dehydration, the person must drink large amounts of fluid which are filtered by the kidneys. Weight loss, however, occurs rapidly since the food that a person eats cannot get into the cells of the body to be used as fuel due to the lack of insulin. The person will feel hungry since they are losing so much weight. Without insulin, a person will literally starve to death within months. Weight loss, drinking a lot of fluids, eating a lot of food, and frequent urination are typical signs of this type of diabetes. This type of diabetes is called insulin-dependent diabetes, and patients with this type of diabetes are typically thin. Insulin-dependent diabetics must have insulin to survive. The second type of diabetes is called non-insulin dependent diabetes. It results from an inability of the body to respond to insulin. In this type of diabetes, insulin production by the pancreas and blood insulin levels are high, but since the body is resistant and does not respond normally to the insulin, blood sugar levels are high. With time, the ability of the pancreas to produce these high insulin levels fails, and the blood sugar controls worsens rapidly. The complications of diabetes come from damage to the blood vessels that feed the body. It's important for you to remember that diabetes affects not only the large blood vessels of the body, but also the very small vessels. When blood is pumped out of our hearts, it goes into the large arteries of the body, which then divide into even smaller arteries. Eventually, blood is passed through the smallest vessels in the body called capillaries. These vessels are so small that they can only be seen with a microscope. The capillaries are made of a small inner skin, which is surrounded by a very thin layer of a jelly-like protein. Sugar, nutrients, and oxygen must pass through this skin and jelly-like material to get to the cells of the body, where they are picked up and allow the cells to do their work. When blood sugar levels become elevated, the sugar becomes attached to the proteins in this jelly-like material and cause it to become very thickened. This thickened layer limits the normal flow of oxygen, sugar, and nutrients from the blood to the cells, and over a long period of time, this causes damage to all organs, but particularly the eye, kidney, and nerves. The higher the blood sugar and the longer the sugar is elevated, the greater the damage to the small vessels of the body. The average diabetic is 20 times more likely to go blind than a non-diabetic, 25 times more likely to develop kidney failure and need dialysis, and 40 times more likely to develop gangrene and require an amputation. The good news is that we now have good preventive therapy so that these problems can either be delayed or prevented altogether. Diabetics are 2 to 4 times more likely to develop a heart attack or stroke than people without diabetes. The major cause of heart attacks and strokes is cholesterol blockages in the walls of the arteries feeding the heart and brain. Everyone, including diabetics, is constantly putting cholesterol into the walls of the arteries and constantly removing cholesterol. The diabetics who get heart attacks and strokes put in more cholesterol than they remove, and the cholesterol builds up to a critical amount and closes off the arteries that feed the body. There are 3 types of cholesterol in the blood: LDL, VLDL, and HDL. LDL and VLDL are the bad cholesterols in the blood, which are settling out in the walls of the arteries, much like minerals in hard water. HDL is the good cholesterol, which is being removed from the arteries and taken back to the liver for safe removal from the body. An imbalance between the bad LDL and VLDL cholesterols and the good HDL cholesterol is what causes artery blockage. When blood sugar goes up, it causes an increase in the bad LDL and VLDL cholesterol and a decrease in the good HDL cholesterol. This is why diabetics have accelerated vascular disease. The good news is that the risk of dying from a heart attack is lowered by almost 2-fold when cholesterol-lowering medications are used to improve blood cholesterol numbers. This is especially important when the total blood cholesterol level is over 205. The current recommendation is that the LDL cholesterol should be lowered to less than 130 in diabetics without known heart disease or stroke, and to less than 100 in those with heart disease or stroke. VLDL cholesterol ideally should be lowered to less than 30. To get the VLDL cholesterol to this level, the triglycerides must be lowered to less than 150. Strokes, heart attacks, and amputations will ultimately cause the death of at least 70% of all patients with diabetes. Perhaps the most important study which demonstrates the value of lowering cholesterol in patients with diabetes was the 4S study, in which over 4,000 patients with established heart disease were randomized to simvastatin 20 to 40 milligrams per day or a placebo. In this study, there were 201 patients who had diabetes. In the next 5 years, the diabetics who received simvastatin, also known as Zocor, were 43% less likely to die from all causes and 55% less likely to suffer major coronary events such as heart attacks. Similar results were found in the CARE study, in which there was a 25% reduction in heart attacks in the diabetics with known heart disease and low cholesterol levels who were given 40 milligrams of pravastatin or Pravachol per day. For this reason, I believe that no matter what a diabetic's cholesterol level is, it should be lowered, since the risk of ultimately dying from cholesterol blockages is so high in every diabetic. One goal of diabetes therapy is to reduce the fasting blood sugar to less than 110. The hemoglobin A1C is a blood test which measures the average blood sugar for 24 hours for the previous 2 months and is the best test for sugar control. Normal is 4.6 to 6.4. The desirable level for hemoglobin A1C is less than 7.0. This test should be performed at least 3 to 4 times per year in every diabetic. Diabetics also have a higher risk of high blood pressure, obesity, high blood cholesterol, and high blood fat called triglycerides. Any increase in high blood pressure, blood fat, and cholesterol level should be treated aggressively to prevent heart attacks and strokes. People who have diabetes for many years are also at great risk of developing kidney failure and needing dialysis or a kidney transplant. Albumin is a blood protein which normally is not filtered by the kidney. The first sign of the kidney damage from diabetes is when small amounts of this protein show up in the urine. This is called microalbuminuria. Early treatment for this protein will prevent the kidneys from going bad. This is an important test and should be performed in all diabetics yearly. All patients with diabetes should have a yearly eye evaluation by a special eye doctor. When early eye damage is detected, preventive treatment can be given and blindness avoided. With proper prevention, the risk of eye damage can be reduced 5-fold or more. This is very important. In addition, every patient with diabetes should inspect their feet every morning when getting up from sleep. If you have corns, calluses, ingrown toenails, ulcers, or any cuts and cracks in the skin, seek medical attention quickly from a foot specialist. Rapid treatment of foot problems reduces leg amputations by a factor of 10. Controlling blood sugar reduces the risk of blindness, kidney failure, nerve damage, and amputation. Controlling cholesterol and blood pressure reduces the risk of stroke and heart attack. Controlling blood pressure also prevents kidney damage in diabetics. Therefore, diabetics should receive treatment for all of these, not just sugar. This is very important for you to understand. Ideally, the fasting blood sugar should be less than 110. 2 hours after a meal, the blood sugar level should be less than 180, while less than 140 would be ideal. Ideally, the hemoglobin A1C should be less than 6, but an acceptable hemoglobin A1C is less than 7. Any hemoglobin A1C over 7.5 should require further treatment. When the hemoglobin A1C is greater than 7.5, the risk of eye damage, kidney failure, and nerve damage increases rapidly. The top number of blood pressure in diabetics should be less than 130 and the bottom number less than 80. Microalbuminuria should be less than 30. There are methods to help prevent kidney failure, blindness, and nerve damage. The best way is for you to maintain normal blood sugar levels. This will require diet, exercise, and in many diabetics, pills such as sulfonylureas, glucophage, and Precose. Insulin may be required in some diabetics. It is also important to limit the amount of cholesterol in the diet to less than 200 milligrams per day. Dietary fat should be less than 30% of total calories and ideally less than 20%. Saturated fats should be reduced to less than 10% of total calories and ideally to less than 5%. Starches and high-fiber foods should be increased. This slows the absorption of carbohydrates from the stomach and intestines and reduces the rise in blood sugar after meals. Let's cover this in detail. There are two types of carbohydrates, sugars and starches. Starches are made from sugars which are linked end-to-end like boxcars in a train. Sugars are very small and can pass directly through the walls of the stomach and intestines and get into the blood. Starches, however, are very large since they are made of many sugars linked together. Starches are too large to pass directly into the blood through the walls of the intestines and stomach. Starches must be broken down into individual sugars before we can get the food benefit from starch. Most starches can be broken down into individual sugars within 1 to 2 hours. Exercise is the second most important therapy. Exercise improves insulin resistance and lowers blood sugar. Exercise also reduces cholesterol, blood fat, blood pressure, and improves heart function and a person's sense of well-being. Exercise must be performed at least 3 or 4 times per week for 30 to 40 minutes. The exercise should be aerobic, such as walking, biking, or swimming. The benefit of exercise depends on the total energy of exercise. The optimum amount of exercise is 2,000 calories per week. You burn roughly 100 calories by walking 1 mile or running 1 mile. We now realize that walking 1 mile is as beneficial as running 1 mile. The major difference is that it's much more pleasant and safer to walk a mile than to run a mile. Before starting an exercise program, be certain that you have a good medical evaluation by your doctor. This should include an ECG and, if you intend to perform vigorous exercise, a stress test. Make sure you have good-fitting tennis shoes and padded socks. Often, despite our best efforts with diet and exercise, diabetics fail to control blood sugar. For these reasons, medication should be used when diet and exercise fail. When diabetic patients start to spill a lot of albumin in their urine, kidney failure will develop within 5 to 6 years unless preventive therapy is instituted. Kidney failure must be treated with dialysis or kidney transplantation or the person will die. ACE inhibitors reduce the spilling of protein in the urine in patients with diabetes and reduce further kidney damage. All diabetics should have a yearly 24-hour urine check for albumin. When the amount of albumin increases over 30, therapy with an ACE inhibitor is indicated. Some physicians think that most young and middle-aged diabetics should be placed on an ACE inhibitor when the diabetes is discovered, since in the long term, risk of kidney failure is so high. Again, the best way to avoid kidney disease in diabetes is good control of blood sugar and blood pressure. Every diabetic should have a yearly eye examination by an eye specialist. Early eye disease in diabetics can be treated with a laser and blindness frequently prevented. If you have blurred vision, reduced vision, floaters, or spots in front of your eyes, or pain in your eyes, you may have the eye disease of diabetes. If so, you need to see an eye specialist. If you will take care of yourself and become part of the medical team, the length and the quality of your life will be improved tremendously. I hope this educational video program has helped you understand your diabetes and what we can do together to improve your health.